It's Dr. LeBeau with a session of For Your Health. And today what we're going to look at is we're going to look at some myofascial release technique, in this case in the lower back. So first I'm going to find a spot here where neck feels tender. So right there.
Right there.
So on a 1 to 10, how would you rate the amount of discomfort?
Probably about an 8.
1 and 8?
Yeah.
Okay. So let's have you bend forward a little bit. Versus back. Which is better?
Back.
Okay, so in the middle again. Now we'll go to one side, to the left, and then to the right. Which one feels better?
This way.
Right.
This way. Yeah. Right.
And now twist away from me. Twist towards me. Which feels better?
This way.
Okay. So let me just have your hand here. How's that feel?
Good. Awesome.
On a 1 to 10, how much pain?
Right now, about a 1.
Okay, one is acceptable.
Yeah.
So typically what we want to do is we want to get ideally at least under a 4, ideally a 2 or 3. 1 is obviously even better. And we're going to hold position here for about 90 seconds, a minute or two. What it's doing is we're giving enough time for the nerve in the area, the nerves in the area to relax, as well as if there's any local swelling in the tissue that might be keeping the nerves from being turned on, if you want. So we're trying to turn off the switch, the pain switch locally here. And one of the things I like about this particular technique is because when we find a position of release, then the patient can repeat this at their own home. And oftentimes I'll prescribe this just like someone might prescribe a prescription of medication or a supplement, where I'll have the person do this 2, 3, and sometimes even 4 times a day. It can be spread out through the day, or if a person knows they're going to be doing a lot of physical activity or things that might be aggravating their pain, they can sort of do this as a preemptive strike just before the activity. Another interesting phenomenon is I find oftentimes the position that gives relaxation to the body has something to do with the position of the original injury. In this case, Nick had suffered a couple car accidents, so you'll get jolted back and forth. Sometimes there can be a seatbelt component to the injury, and it jams up the whole musculoskeletal and nervous system. Okay, now let's have you sit up. How's that feel?
Perfect.
So tell me what's your experience with this, doing this, because you've been doing this at home sometimes?
Yeah. Do it at home when the pain escalates. And I've found it better because I was on pain medication for years. And this gets rid of the pain much better, more efficiently than pain medication. Really, it's
Well, side effects.
Oh, yeah, no side effects except no pain. So it's really, it's not a joke. I mean, it is absolutely real. I'm very grateful that you taught me this, because there are times I do it 4 times a day, and it's because pain varies. Like you're saying, depending on what you're doing and how active you are, and it's 0 side effects, which is just something I haven't experienced before. So we started doing this.
So I'm Dr. LeBeau with this episode of For Your Health, showing you myofascial release